Good evening, ladies and gentlemen. My name is Marcel Akuneme. I'm one of the members of the National Association of Sea Dogs, Atlanta, based here in the US. Today is International Women's Day. Um, Before I start, I want to recognize our chapter president, Mr. Jude Orebu, and Vice President, Mr. Chike Madibuna. Welcome. We're also streaming live on Facebook and on YouTube. So most people are out there right now. Okay. So today is International Women's Day. On this day dedicated to the recognition of women's challenges and achievements, we know that a good health lies at the base of the greatest contribution one can make to the family and society at large. So while we work towards an inclusive, gender equal, free society, free of bias, stereotypes, and discrimination, we strive to empower women's health and improve awareness on issues facing them. So today, the National Association of Sea Dogs proudly salute all these women in our lives, mothers, wives, sisters, colleagues, daughters, friends. We thank you for your priceless contribution in our lives and society. We wish you all a happy International Women's Day. Stay strong, keep striving, and keep thriving. May you have more successes ahead. Our focus today is on the health challenges women face. Breast health awareness being on the forefront of that. More specifically, we're going to be talking about breast cancer. So today we have two accomplished speakers on this topic, Dr. Obi Obata and Dr. Chika Apiu. So, Dr. Obata is a medical oncologist, hematologist with over a decade of experience in clinical practice, research, academic initiatives, hospital administration, having served in multiple roles, including co-chair, head and neck thyroid cancer committee, Xavier Clinical Pathways, clinical research leader, medical oncologist and hematology, Levine Cancer Institute in Cleveland, North Carolina, oncologist, hematologist and Novant Health Cancer Specialist, head and neck oncologist at Novant Cancer Institute, clinical assistant professor of medicine, University of North Carolina School of Medicine, chair and president, Association of Nigerian Physicians in the Americas, ANPA, Carolinas. She is a doctor's doctor, a mentor and a friend to all, dedicated to uplifting all that she meets. She'll be talking on breast cancer highlights. We also have Dr. Chika Okem Akwiwu, DNP. She's a breast cancer survivor and an ambassador for women's health. She's double board certified in psychiatry and family nurse practitioner with over a decade of experience. She's also a dynamic entrepreneur, spearheading innovative ventures in telemedicine, weight loss clinics, and into luxury real estate development too. Most of all, she's a dedicated wife, a devoted wife, mother of 5, and caregiver to her 90-year-old mother. She embodies resilience and balance. As a breast cancer survivor, she turned her personal battle into a mission, founding the Breast Health Angels Foundation, a worldwide outfit that champions early detection and proactive wellness, empowering women facing breast health challenges through awareness, education, mentoring, and advocacy. Early detection saved her life, and she is fiercely dedicated to ensuring it becomes every woman's greatest defense against breast cancer. And in her own words, ensuring that no one battles alone. She'll be talking about life during and after breast cancer. Our moderator today will be Mr. Boyega Oshinowo, one of our members here. I'll be handing this over to Mr. Oshinowo. Boyega, it's up to you.
Thank you, my brother. Greetings to everyone, depending on wherever you're joining us from around the globe. I want to say good morning, good afternoon, good evening. As we proudly join the wall in celebrating the International Women's Day 2025, I want to use this opportunity to welcome everyone. Again, this event is being powered by the National Association of Sea Dogs, specifically from Atlantis Deck, which is the Atlanta and the Southeast chapter of the association. A quick expectations or ground rules. Today we'll be discussing how we can empower women through education and resources about breast cancer, which can lead to better treatment outcome, early detection, and improved health overall. My brother has already just introduced the speakers, so I won't really spend time on that. We will have time for questions from the audience. I know we have audience joining from Facebook Live, YouTube Live, and also a few on Zoom. For those joining us on Facebook Live and YouTube, feel free to post. You may not be able to make some verbal comments or questions, but feel free to post your messages or your comments or questions on the comment fields. But those on the Zoom, you have that privilege to be unmuted and ask questions. Without much ado, let me bring on the first speaker. Again, I won't waste our time doing a lot of introductions. The profile of all is set. Now, ladies and gentlemen, let me welcome, and then please, I missed one thing. Questions and answer will be taken after each speaker. Once the first speaker completes speech, we will be free. The floor will be open for questions and comments, and then we'll go into the next speaker. All right, without much ado, ladies and gentlemen, friends, let me welcome Dr. Ogbata to the floor. Dr. Obi, you're welcome.
Yeah, hello everyone. It's my pleasure to be here to give you this talk on breast cancer. So let's go. So my talk will be a short snippet on breast cancer highlights. It's really the highlights because as a medical oncologist, there are actually medical oncologists who devote their careers to breast cancer alone. So this is a topic that you can speak about every different aspect of breast cancer every day for the whole year. Next slide. How do I advance? Okay. So as we all know, 1 in 8 women will get breast cancer in their lifetime. For the 287,500 new cases of breast cancer, that was the projection in 2022, that were women, about 2,700 of them were men. So that goes a ratio of about 100 women to 1 man with breast cancer. So sex is obviously the most important risk factor. Being female, sex is the most important risk factor for breast cancer. October, we all know, is Breast Cancer Awareness Month, and there are about 3.8 million, more than 3.8 million women breast cancers in the United States alone. So that's a big healthcare burden. This is the incidence of breast cancer worldwide. North America is second only to Australia and New Zealand in terms of new incidence, that's new cases per year. So this slide talks about female breast cancer incidence. This goes from 2015 to 2020. The pink bars shows the number of breast cancer cases, and the deep pink bar shows the deaths from breast cancer. Based on this graph, we can tell that breast cancer is most common in white women. However, Black women are more likely to die from breast cancer, almost double than white women, American Indian, and Alaskan Natives, which are the second most likely to die of breast cancer. Then the Hispanics are least likely to die of breast cancer. So this, we'll talk about why the kinds of breast cancer that Black women have the biology is a little different, but that's the sad statistics. So this is the American Cancer Society. For index and purposes, today we'll be talking mostly about the invasive breast cancer, but there's what we call stage 0 or non-invasive breast cancer known as DCISs. DCI is ductal carcinoma in situ. We expect about 56 1,500 new cases this year, while the invasive cancer cases are estimated about 310,000, and about 42,000 women are expected to die from breast cancer this year. So to the right of the screen, you have the 3 common types of breast cancer. Now we're talking about invasive disease. Here is a sagittal view of the breast. These are the lobules that produce, these are the milk ducts, and we'll see later in a more picturesque form. So these are the lobules that make the milk. These are the ducts that carry it, and this is the nipple. So this is lobules, ductal. So in this case, there's invasive ductal cancer that affects mostly the ducts that join the lobules to the nipple. And you have the invasive lobular cancer that affects the ducts that actually produce the milk. In this type of breast cancer, there's really not a mass. It doesn't really affect the lobules or the ducts. It's just an inflamed situation. The breast is red, hot, and hard. So these are the 3 common types of breast cancer. Then here, this talks about breast cancer in men and women and the most likely estimated deaths from cancer overall. We can see in women, breast cancer ranks only second to lung cancer in terms of mortality, cancer-related mortality. Because men don't have breast, they have breasts, but it's a lot less likely. And a man is more likely to die from colon cancer or prostate cancer compared to breast cancer. We can't overemphasize the fact that early detection saves lives. And these are some of the ways we use to screen and test or diagnose breast cancer. We have the breast exam that we encourage women to have. We have the breast ultrasound, we have the mammogram, we have the breast MRI. And when we find something suspicious, we send women for breast biopsy. Then we talk about the staging. So despite the campaign, and Dr. Akwi will talk more about that on early detection saves lives and the need to have an annual mammogram, these are the prevalence of mammogram. This shows prevalence of mammogram among women that are 40 or older in the United States. You can see overall, for women who are 40 to 44, who have had their mammogram within the past year. So those who have it every year, only 38%. Less than 50% of women 40 to 44 have their mammograms every year. Those that have it at least once every 2 years in that age group, barely half. So there's a lot of room for improvement here. It's much less so for the slightly older women. We're approaching rates of 73% and 77% in 2 years. But based on what we know about early detection saves lives, this leaves a lot to be desired. So I'll dwell on this slide a lot because breast cancer, as we know, there are risk factors for breast cancer, but it's a largely preventative disease. As much as we think 1 in 8 women will have breast cancer, that's a fact. But this kind of states the different risk factors and how heavy, how mighty, how deep those risks are. Like some of these, alcohol consumption goes anywhere from increases your risk 1.1 to 2 times, while older age increases your risk of breast cancer by 4 times. So by far, the strongest risk factor for breast cancer, I would say 1 is female sex, 2 is age. Of course, if you have any abnormality at all in the breast, that predisposes the issue because it shows that your breast tissue is no longer healthy. If you have any of these genetic mutations, that's also a risk factor. Then personal history of early onset breast cancer also. Those are the ones that have the highest risk of having a repeat breast cancer. If you have DCIS, like I talked about before, that's a stage 0 breast cancer. That increases your risk by 2.1 to 4% or 4 times. If you have high endogenous estrogen or testosterone use, like women who are postmenopausal, polycystic kidney disease, and some of those things. If you've had radiation to the chest, like you had a lymphoma and it had to be treated with radiation, that increases your risk of breast cancer. If you also have, what we call the dense breast, those women have risk of breast cancer. If you've had breast cancer, maybe at older than 40, your chances of having it again is a lot higher. If you had it before age 40, your chances of having it again is much higher. And if you have 2 or more first-degree relatives with breast cancer, even if you don't have any of these genes, your chances of having breast cancer are high. And some of these risk factors are actually a lot not so strong, but they are there. The funny thing about alcohol consumption is, unlike liver disease, where the more alcohol you consume, the more likely you are to have liver disease. For breast cancer, just alcohol consumption, period. So you might just drink a glass of wine 3 times a week, and someone drinks 4 glasses of wine every day. Just the exposure, regular exposure to alcohol increases your risk of breast cancer. Also, women who have a long, we say fertility interval, like if you had your period early and didn't have your menopause till later. So there's a long time when your breast tissue is exposed to estrogen. Also, if you didn't have a baby early enough, you never breastfed a child, or you have one first-degree relative with breast cancer, all these things increase your risk of breast cancer. Also, using hormonal therapy, not the usual, the birth control pills increase the risk a little, but also preventative against ovarian cancer. So that has some benefits. But using hormone replacement therapy for women who have terrible hot flashes after menopause, that increases the risk of breast cancer. Also, people who gain weight in adulthood and type 2 diabetes. So when we talk about risk factors, we're looking at, if you have genes, there's really not much you can do about that. But we're looking for things that we can hopefully modify to decrease our chances of breast cancer. We talk about risk factors, genes versus environment. So breast cancer and lifestyle, we're taking a look at the US versus Japan. In the United States, 1 in every 8 women will be diagnosed with breast cancer. In Japan, 1 in 38 women will be diagnosed with breast cancer. So that means the American women are 4 to 5 times more likely to be diagnosed with breast cancer than the Japanese women. So there was a study that looked at the blue zones. There's a place in Japan called Okinawa. The blue zones are places where there's a vast majority of people in those areas who live to 100 years or more. So studies have been going into what they do, their lifestyle, how they eat, and things that help them live longer. So they found out that Japan's low consumption of red meat, high intake of fish, whole soy foods, vegetables, and unsweetened beverages, such as green tea, were thought to account for their low mortality rate for breast cancer and prostate cancer. So there, in this Okinawa, they ate mostly whole plant foods, made up like 90% of their diet. They also had a lot of antioxidants and anti-inflammatory stuff in their diet, like vegetables, whole grains, organic stuff, soy products, and green tea. So they are also 5.5 times less likely to die of breast cancer than the American woman. So other things we can do to prevent cancer, I was just telling someone, if you're in a multiple choice exam question and they're talking about something good and exercise is there, just choose it, because exercise is good for everything. I don't see any downside to exercise, except maybe you do too much and you hurt yourself. Exercise for cancer prevention prevents breast cancer, endometrial cancer, kidney cancer, heart disease, bladder cancer, esophageal, stomach cancer, and colon cancer. And then to my right, there's a concept that is not much, that I don't think gets as much press as it should. And that's vitamin D and your health. Looking at this slide, you find out that women who have vitamin D levels of 60 have 83% less chance of lower risk of breast cancer than someone who has vitamin D level of 20. So the higher your vitamin D level, the better. A lot of us are not out in the sun because it's either too hot, it's either too cold. We go from our garage to work, so we don't get enough vitamin D. So every adult woman should actually be on a vitamin D supplement. Again, I say that with caution, because vitamin D is a fat-soluble vitamin, so you can actually have too much. If you take too much, it gets stored away in your fats. So please do it on that. Make sure you have your vitamin D level checked at your PCP's office. Aside from breast cancer prevention or lowering the risk of breast cancer, vitamin D has also been found to be good for bone health, colon health, so helps prevent colon cancer, calcium and vitamin D, as well as prevent autoimmune disorders like lupus, rheumatoid arthritis, and all that. So vitamin D is, I think, is low-hanging fruit. If you can take a vitamin D supplement every day, at least that's something you can do. That's something you can do to improve your risk of breast cancer. So here is just a quick scientific, but I thought it was very picturistic and kind of puts a picture. A picture is sometimes worth 1,000 words. To the left is the breast. This is what the breast is this is what the breast looks like. It's about 70–80% fat. You see the lobules I talked about and the ducts and the nipple. Then that's the pectoralis muscle, pectoralis major and minor muscle. Those of you who do weightlifting, this is actually good because if you build your muscle, it can actually give you a good breast lift. But this is muscle and ribs behind the muscle on that supporting the breast. So first, the breast cancer starts at these abnormal cells there. The lobular one starts in the lobules. The ductal one starts here. This is what the normal inside in the lumen of the tissue. This is normal. This is when it starts becoming abnormal. This is when it becomes cancerous. This is ductal carcinoma in situ, DCIS, but it's still contained with this wall. So it hasn't broken free. So by definition, DCIS, non-invasive breast cancer, can't spread. This is when it's broken past the membrane. So this is now invasive cancer. Then the metastatic is when it gets into the bloodstream and travels to other parts of the body. So here is why we hear some of the things we hear. To the left shows the location and the most common sites for the breast cancer. We can see that 42% of breast cancers occur in this axillary tail. So that's why there's been press about roll-on antiperspirants, perfumes, and things like that. The greater majority, and also from trauma, when you move your arm, it's more likely that area, that part of the chest wall is more likely to undergo blunt trauma or abrasive injury. So that's the most common area, followed by we call this the upper outer quadrant. Then you have the upper inner quadrant. You have the upper inner quadrant, yeah, the lower inner quadrant, and the upper lower quadrant. So these are less common. So in a nutshell, talking about breast cancer prevention, we say keep a healthy weight. For women, when you're obese, there's an enzyme called aromatase in the light adipose tissue that actually breaks down sex hormones, so estrogen. So most obese women are actually in a hyper and estrogenic state. So you're exposing your breast tissue to more estrogen. Again, be regularly, do regular exercise, be physically active, avoid alcohol, your diet, limit your fat, breastfeed your children. Of course, early detection saves lives. Go for your checkups. And if if you have a family history of breast cancer, talk to your doctor, because you may actually be a candidate to have earlier screenings than age 40. So here are some of the symptoms of breast cancer. You can have some skin changes, some redness. You can have discharge, dimpling, pulled in nipple, or a lump. Could present in so many, or even breast pain. Present in so many different ways. So here are some of the types of breast cancer. We talked about the DCIS not really being relevant because that doesn't spread because it hasn't gotten beyond the membrane. We have 3 main receptors we look for in the breast cancer. Usually anyone who knows anyone that's been diagnosed with breast cancer, you can't make a diagnosis of breast cancer except you give information on these 3. And that's the hormone receptor. And the hormone receptor, you have the estrogen receptor, you have the progesterone receptor, and you have the HER2. HER2 is a protein that can be on the membrane of the cells. So the first subtype, which is the most common, is if you're a hormone receptor positive or HER2 negative. So that's called hormone receptor positive breast cancer. The next subtype is when you're what we call triple positive, your ER, estrogen receptor positive, your PR, progesterone receptor positive, as well as HER2 receptor positive. That's 10% of all cases. Then you have those who are just HER2 receptor positive and negative for estrogen or progesterone. That's least common. Then the super aggressive type, which is triple negative, you're negative for all three. This can only be treated with chemotherapy. And this is what explains the reason why Black women have a higher mortality rate, because Black women are more likely to have triple negative breast cancer than any other type. I mean, this is the most common in all races, but I think Black women are enriched to have triple negative breast cancer and also the hereditary forms of breast cancer. So here is talking about some treatments. So when you talk about molecular subtypes, this is more for people in medicine. You have the luminal A. We talked about estrogen, progesterone receptors. But so when you're hormone receptor positive, we treat with hormonal therapy or endocrine therapy. That's usually pills. When you're HER2 positive plus hormone receptor positive, we treat with endocrine therapy. For HER2, you have to give chemo to the targeted therapy, right? If you're HER2 positive alone, you treat with chemotherapy and targeted therapy, no endocrine therapy. So once there's hormone receptor positive, you have to add endocrine therapy. Once it's HER2 positive, you have to add targeted therapy plus chemotherapy. You can't give targeted therapy alone. And once it's triple negative, you can only treat with chemotherapy. And this is PARP inhibitors. We use those mostly for those with germline mutations in the BRCA genes. So, take-home points from all I've said today. Breast cancer is real, it's relevant, it affects us. 1 in 8 women, the 8 women could either be your family member, co-worker, friend, church member, it could be anybody, but breast cancer affects all of us. It's the second leading cause of cancer deaths in women. 1 in 8 women will be diagnosed with breast cancer throughout their lives. But I want us to leave this talk being hopeful, not just, 1 in 8, that's a pretty big chance. It's a largely preventable disease. Yes, we do have the genes that cause breast cancer, but that's in less than 5 to 7% of all women. We saw the story about the Japanese women. A lot of it is actually around the environment, what we can control, what we eat, supplements we take, our daily lives. Of course, we know mammogram, early detection saves life. Even when you have the breast cancer, let it be caught early, because chances of survival are highest when you're detected early. And again, something that I don't think is emphasized enough is the stress component. Manage stress, manage stress, manage stress. As women, we hold a lot of responsibility. Okay, so I brought this slide up to remind us. So manage stress, the cortisol hormone, you increase abdominal fat. Well, when abdominal fat is increased, insulin growth factor increases. That, you talk about antioxidants, that puts a lot of oxidative stress on the body and can cause tumorigenesis and all that. So can't overemphasize that. Then we talked about, when talking about lifestyle and things you can do, remember the Japanese women, this 1 in 8 women ratio, they found that when these women migrated to the United States and adopted the Western diet, their rates became closer to the 1 in 8 women like others in the United States. So environment has a lot more to do with breast cancer than we actually give it credit for. So I have this case to review leading on to the second part of the talk with Dr. Akwiwu. This is a lady, a real patient, a 36-year-old bank executive who felt a mass in her right breast. No family history of breast cancer. She saw her PCP who requested a mammogram and it was abnormal. I mean, at 36, that was way too early to start breast cancer screening. We recommend 40, right? She had a biopsy that confirmed triple negative breast cancer. She was referred to the surgeon and medical oncologist, diagnosed with stage 2 breast cancer. She was started on chemotherapy initially, especially if you can feel the lump. Once the lump is 3 centimeters or more, you get chemo. Then after chemo, 2 to 3 centimeters or more, you get chemo, then have surgery, then have radiation. Now she's 6 years out of treatment and doing well. So lots and lots of successes with breast cancer diagnosis, screening, and treatment. So we'll have Dr. Akwiwu now take over and talk about live, during, and after breast cancer. Thank you.
Thank you. Thank you, Dr. Obi. Really appreciate that. That's very concise. However, before we move to the next speaker, Dr. Akwiwu, let's just use this opportunity to entertain questions and comments. Again, we are streaming live on Facebook, YouTube. So please feel free, if you're on those platforms, just type in input your comments in there or questions. We will take them. We have people monitoring those platforms. However, if you're also on Zoom, you can, signify by raising up your hand digitally, or just put in a comment in the chat field. Question and answer at this point. I think we have a question now. Go ahead, please. I see a hand.
Thank you very much, Dr. Obata. Thank you. That was a very informative session. So my question is this: from what I heard from you, from what I surmised, a lot of what we see is that diet has a lot of impact on breast cancer, because like you said, we see people from Japan that move over to the United States and imbibe in the Western diet, and all of a sudden they have the same cancer rate as us. Do we have any type of statistics about when it comes to Africans? Like you mentioned, Japan, do we have any statistics when it comes to Africa? And is there any impact that our diet has, the typical African diet has on breast cancer? That's my question. Thank you, Dr. Obi.
Sure. So I didn't share here, the Japanese, the Japanese data was more crisp and concise, but yes, in Africa, there's breast cancer. But our diet is actually protective because our diet is is rich in organic foods, lots of vegetables and all that. The main thing that causes breast cancer is super ultra processed foods that you can't put in the ground and it grows. And there's lots of that, canned foods. There's lots of that in the United States. Nigeria, we still eat a lot of meat. There's nkwobi and all that, but we eat lots of vegetables too. So we don't have quite as much fast foods as they have here. So just coming from Nigeria here and trying to adopt the Western diet is detrimental. We can see the increased incidence of not just breast cancer in Nigeria, but also diabetes, hypertension, and all those stuff, just by adopting the Western diet.
Thank you very much.
Right. Thank you.
I can add to what Dr. Obi is saying.
All right. Dr. Chika, go ahead.
Yes, I was in Nigeria for their World Cancer Day, and their statistics is worse than ours. And the problem with the statistics in Nigeria is that the validity of the data is not quite sure, because a lot of people, due to cultural implications, are not reporting, diagnosis, and then also poverty is a big factor, because care is very limited in Nigeria. So the Nigerian aspect suffers a lot of dimensions when it comes to statistics, breast cancer diagnosis, treatment, prevention, because education is one, and the people who are even educated, due to cultural implications sometimes, are not even getting the care or seeking the help. And then the people that are poor, they don't know any better. So there's so many, truthfully, we're quite plagued as a developing country, in terms of diagnosis, treatment, and statistics of breast cancer. We have good food, like Dr. B had mentioned. In terms of food, diet is better. However, I wish diet was the only thing that determines, our diagnosis. We have better diet, but lack of education, poverty, limited information and data. There's so many things that are affecting, our diagnosis of breast cancer, and it's very sad. Like, it's just quite sad. Very sad.
Yeah. Like even stress, if you live in Lagos, to get from the mainland to the island takes 4 hours every day just to share stress. I go to Nigeria, and after a week, I'm ready to come back to the United States. Stress and, like you said, lack of data and just medical literacy. People are just not informed. And believe it or not, people still hide cancer diagnosis. It's almost like a taboo to say you have cancer, because then your family starts getting avoided because it runs in the, so people actually do hide that they have cancer. So they don't have the correct statistics. They don't expose themselves to the care that they need. It's just a multifaceted problem back home. But the diet is good. It's just a lot of other problems.
Thank you, doctors. Yeah, that means there's a cultural impact, cultural perspective to that. All right, we have a question in one of the comments platforms from Emeka Iziri. It's saying, what's the impact of cited low risk factors in the prevalence of breast cancer in younger population? And I know you mentioned age 40 and all that stuff.
Yeah, so the impact of the factors that we talked about. Correct.
The risk, the low, what you said, what's the impact of the cited low risk factors in prevalence of breast cancer in the younger population? So in other words, more or less like what's the data on younger population? Yeah.
So the data is for everyone, but for the younger population, I think the genes play a stronger role. If you have breast cancer at age 40 or less, it's more likely due to a germline mutation, than your diet or you're not having enough exercise. I mean, all those things add up over time, and there's data to show that they do. But for people, but that's why by age 65, your risk of breast cancer is 4 times someone who is 30, because you've had multiple years of exposure.
900 feet, something.
Thank you so much.
Yeah.
Looking at all the platform. Any questions, any comments before we move to the next speaker? All right. We don't have any questions at this point, but we'll still have room for questions at the end of the program. All right. Thank you, Dr. Obi Ogbata. Thank you so much. This is very, very empowering. And just to remind us, I know many of us might not know the theme for the International Women's Day for this year worldwide is rights, equality, and empowerment. Special focus on empowerment. Because you all agree with me, education and resources for women. But breast cancer is definitely an empowerment program, empowerment factor. All right, let me bring on the next speaker. A lot has been said about her already today. The name has been coming up back to back. She's a survivor. She's she is the founder of the Breast Health Angels Foundation, and there's a lot on her profile. The profile has been read initially. I don't want to waste a lot of our time, but this is someone that's very knowledgeable and has experienced this topic in real life. Ladies and gentlemen, give me the opportunity to welcome to the podium, Dr. Chika Akwiwu. Over to you, Ma.
Perfect, thank you. Thank you. Thank you so much. Sorry, guys, I want to apologize. I'm actually in a car. Thank you so much for the introduction.
Dr. B, thanks again for that wonderful breakdown of breast cancer risk factors and all that it pertains. Thank you to the National Association of Sea Dogs for creating this platform where we can empower themselves for women empowerment. We're very grateful to you, our husbands, our friends, for everything you guys do to make lives better for women and your sisters.
Breast cancer is real. It's real. As a survivor, breast cancer never. And I just want to really commend anyone 35 to 36 on a Saturday that is listening to all this stuff, because I was diagnosed at the age of 36, and God knows that I wasn't spending my Saturdays being educated. You're here
and you're 36 plus, well done for making your health priority. At the age of 36, I was diagnosed with breast cancer. I wasn't expecting it. Like I said, risk factors tell us 40 plus. So it wasn't in my, visibility. Like I wasn't even thinking that. So the advocacy of Dr. Jacqueline Walters, my mentor and a 2-time breast cancer survivor, was the call to duty for me to go get a mammogram. And I didn't have any palpable lump. It was just purely advocacy. Moving forward, I, took the call, got a mammogram, and I was diagnosed with breast cancer. So this is 14 plus 15 years now since surviving breast cancer. And the truth of the matter is this, it really never leaves you. It depends on the day. Like today, I'm happy, I'm excited, I'm in the car, I'm going to a 50th birthday party of my friend to celebrate life. And life, I must say, I'm grateful for. However, the psychological, emotional factors, of breast cancer it's every day with you. So 14, 15 years plus, I'm still here. I'm grateful. However, my day-to-day life, varies. There's trauma that goes with cancer. You deal with the diagnosis each time as a mentor and a leader in the community, people refer people to me to talk to them, to encourage them when they're newly diagnosed with breast cancer. Each time I do that, I relive the experience, right? So there is always the fight to find balance between surviving, the anxiety of reoccurrence, and just like living life as a human being. Then there's the physical aftermath. In my story, with life after breast cancer, initially my scars were a reminder of my pain. My scars were a reminder of almost, because a woman's breast means everything to her. Like a woman's breast is our honor, is our confidence. And when your breast is tampered with as a woman, it affects you. It affects your identity. It affects how you feel, your sensuality. It affects everything about you. So initially, my scars were almost a daily reminder that I wasn't enough. But as time, not just time, just being a believer and having a positive mindset, that began to change. The positive mindset that I'm still here, the positive mindset is that I have my children, my husband, my mother, the positive mindset that, I could have passed. You start to go from being negative and letting your scars define you to becoming more positive, that you are alive and you're well. So it takes a toll on you, but it's something that comes with time, you know. And then you also go through the the effects of I'm a breast cancer survivor. Every time you see a doctor, you're going to talk about, oh, what are your give me your medical history, right? What's your medical history? What are your surgical histories, allergies to medications? Because your history determines your treatment. So every time you see a doctor, they're going to remind you. They're pretty much going to go through that all the time. And truthfully, my history of breast cancer determines my treatment in everything. Okay. Fast forward, it was 14 years, about 6-7 years ago, I had abnormal bleeding. And for someone who is not a breast cancer survivor, Dr. B would know that, oh, let's give them hormones, right? Let's give them hormones to stop the abnormal bleeding. But in my case, this was quite interesting. My same OBGYN, I went back to her and I'm like, okay, see what's going on with me. And it was so not well funny. I can laugh about it now. The way she looked at me, she's like, you have abnormal bleeding. You know what that means, right? I'm looking at her and she's looking at me like, yes, that means a hysterectomy. That means hormonal interventions are not for you, right? So this is me living my life after breast cancer. I had a hysterectomy. It wasn't an option not to have a hysterectomy. Why? Because of breast cancer. It continues to affect the decisions that are made for you medically. It never ends. That's why you have to make a decision to stay positive, find balance with gratitude, find balance even in your anxiety, find balance in your insomnia, find balance in the trauma, because it's a good thing. It's a great thing. And the only reason I can talk about it today is because of early detection. So talking about today being International Women's Day, the idea is for women to take their power back. Women need to take their power back. Research shows that one of the reasons women don't do mammograms is fear. Fear is the number one reason why women don't do mammograms. But guess what? As a breast cancer survivor, I have changed my mentality that mammograms or scans, in my case, I still do scans to stay proactive, right? So when I have to go for a scan, I'm kind of like, oh my gosh, is there a possibility of the unknown? Is there a possibility of there's an element of fear to relieve what if something is discovered? What if there's a tumor? What if, because I'm doing scans, my chest, my abdomen, and what if? There's always a factor. However, I've changed the scans in my head to say, I'm taking my power back, to say I'm staying proactive. Scans are life givers. Scans are not life takers. So if I can say that, and you're one of the women out there that have not gotten a mammogram because you're afraid of the unknown, not knowing is a death sentence. Ignorance is a death sentence. Change your perspective. Let scans and tests become life-saving strategies, life-saving remedies. Change it from an element of fear to something good. Take your power back. Because early detection is your only defense against breast cancer. Because of early detection, I'm here. Because of advocacy, I'm here. So that's why, platforms like this that are created, women, we need to take it seriously. It gets boring. Oh my God, the same risk factors. Oh my God, these cancer people are all over the place. Oh my God, they keep talking about 1 in 8 women. Because it's important. Because it matters. And because it can save your life. So that's why we keep talking about it. That's why we keep hammering about it. So as a survivor also, I go through the emotional toll of, being alive, because every time someone else is diagnosed with breast cancer, It's a reminder that you're here. It's a reminder of what you went through, but also a reminder of gratitude that early detection saved my life. That is the message. That is the message, to take your power back. Let fear not hold you back from making a decision that could cost your life, a decision that could literally kill you, you know? So as a breast cancer survivor, I continue to engage in my support system. I continue to engage in my community, you know, and that's why I do things like this to encourage women, because I feel like God saved me for a reason. Does that mean that I don't have bad days and days that I feel like something could have been different? Of course. But more than that, I am grateful. Advocacy saved my life. Early detection can make the difference between life and death. We cannot say it enough. And the only thing you can do is stay proactive. Because, you know, when Dr. B talked about risk factors, the interesting thing about risk factors, and I wanted to also ask her this question, is this. Risk factors, I didn't fit the mold. Dr. B, I didn't fit the mold. I was 36, right? I was 36. I wasn't obese. I wouldn't say I drank alcohol like that, right? And then also my BRCA testing, I did BRCA test and it showed that I had no genetic predisposition to cancer. I didn't have any genetic genes. I've done BRCA testing twice. And then they talk about nursing. I nursed my children. I was that, oh, you got to nurse your children. I nursed my children from 6 to literally 12 months. My husband would be like, it's enough. What are you doing? Right? And they used to say risk factors, nursing is supposed to reduce your risk. So I wasn't the typical breast cancer patient. However, I still had breast cancer. So what does that mean? That tells us, regardless of all the risk factors, your best protection is to stay proactive. Your best protection is to get the mammograms in, do the self-breast exams, because you know your body more than the doctor. You know, even Obi will agree that the doctors will tell you, like if you go to your doctor and say, oh, something changed, they're going to listen to you because they know you know your body more than them. So this, you know, like these things are so important. It creates awareness in the community. It reminds us on the need for, because women, we are mothers, we're the foundation of our homes. A house where the woman is gone is a house that is broken. So we have to really stay proactive, you know, and then as a survivor, the mental health is always present. However, my community helps me. Doing things like this are very uplifting because it reminds me on why I'm here. It reminds me that God kept me for a reason. So it helps me balance out my anxiety and my trauma and the depression and the insomnia. And uplifting women, the mentorship helps me balance it, finding a balance between, you know, gratitude and the anxiety. That's what keeps me going. Okay. New perspective. Cancer gives you a new perspective on life. And like I keep saying, positive. Yeah, I stay positive all the time. I stay positive. I stay positive. I stay positive. So I'm so grateful for the opportunity to share my story all the time, to encourage survivors who are out there, to encourage women who are not sure if they should get screened, women who religiosity, cultural limitations are holding back. And interesting enough, it's not even about having money. I have friends who are so rich that when I ask them, have you had your mammogram? They're like, are you mammogram police? Right? So sometimes it's sad. So that tells me we have work. Like our work is cut out for us because you have money, you have the education, You have the knowledge. Why aren't you getting a mammogram? So we have so many issues, you know, and then of course there are women who don't have the money, and that's where we come in. You know, if you're a woman out there and you want to get a mammogram and you don't have the money for a mammogram, please reach out to Breast Health Indians Foundation. We're here to support you. This is why we do what we do, because early detection can make the difference between life and death. Thank you.
That was awesome, Chika. Awesome, awesome. Oh, this is really great to hear from someone who survived breast cancer. And yes, you're one of the minority that have breast cancer in their 30s that don't have either a gene or other heavy risk factors for real. But there are a few of those, that we see in practice.
Thank you. Thank you, Dr. Chika and Dr. Obi. Yeah, that was great. Looks like we have a question already. Please go ahead.
Hey, thank you again for your speech, Dr. Chika. This is Chike Malebuna. I have a few questions, actually. I had to write them down. So one of the points, I think the main point you raised was how to encourage people, how to drive people out to go for the scans, because like you said, scanning saved your life, and that's one of the most important ways to detect cancer and stay ahead of the curve. So the question that I have for you is, in your experience, what has been the most effective way to drive people to go and do the scans? And I ask that because, number one, you're a lady, you have the experience already, right? And you actually have an initiative that you have started to help women, but you still find it difficult to convince some people. So that's why I'm asking the question. We as, number one, men, number two, we've never experienced that. How do we even hope to convince our sisters, our siblings, or even our female friends without appearing creepy?
Yeah.
No, but that's a thing. Yeah, that's a thing. Like, yeah.
Well, okay, so let's start with your wives, right? With your wives, you know, because I counsel women with cancer, I've had one or two women say that it was their husbands that discovered the lump in their breast. So as husbands, helping your wives with their self-breast exams, it's very important. That's one way to encourage them. One. Then number two, your sisters, right? Sharing information with your sisters and your mothers and your cousins and your girlfriends. Sharing information with them, like, you know, because what happens with information? Somebody sends you an information, you read it, right? You might not respond, but it goes somewhere in your head. Because what we see, we filter into our heads, right? So sending the information, having the conversation is very important. Then in our case, when we do promotions, we always bring a comedy into it, right? We bring comedy into it. We include children into it to tell our mothers that you want to stay alive to raise your children. So creating strategies that bring urgency, that transcend culture, like these are ways we have tried to make it exciting and interesting, right? That's why when I talked to Dr. Obi earlier, we're like, okay, how can we make this fun so that people can engage? Because what it is also is the information is out there, but people have become bored, right? So how do we make it fun? How do we make it, in such a way that people can assimilate? People can, like, oh, it's a cool thing. Like this Gen Zs will call it a vibe, right? How do we make it a vibe? How do we make it a lifestyle? Like, how do we make it in that you should go get a mammogram, right? So I feel like those are the next steps for all of us as a community to, kind of like figure out like what else can we do, because the statistics have not really improved.
Makes sense. Yeah. Yeah, I get it. Yeah. So I have a couple of moderator, please. Are you done? Can
Yeah,
I?
go ahead. Go ahead. Yeah.
So scans. You did mention that if people have problems with getting scans, access to scans, they should reach out to your foundation. But
Yes.
what other resources are there apart from your foundation? Is there any other resource free, even if it's paid or subsidized?
Yes.
Please?
Yes, Susan G. Gorman. Susan G. Gorman Foundation, they're the biggest or largest resource for breast cancer.
Susan
Okay,
G.
so people can go to Susan G. Komen Foundation to see. They always have free mammograms because it's a big NGO that people give millions of dollars, and they're able to provide free mammograms, low-cost mammograms based on different eligibility criteria, right? Because just like us, we don't want people come in and say, I need a mammogram. Meanwhile, you're driving a big car. I was going to say, hell no, but we won't give you one, right? We don't want people who are carrying big bags. Like, you can do it. So there has to be an eligibility criteria that makes it okay for us to pay for you, not just because you want one.
Right. No, get it. Okay. All right. So again, my third question kind of ties into the first one that I asked already. What has been the most, like you said, you want to make it a vibe, but what has been the most impactful way that you've communicated? What has been the way that has motivated people the most, that your way of communication, what you've realized? Is it direct communication? Is it intervention? What has been the most effective way to get people to go and get their scans done?
I think over the years, what we found is, adding humanity to it, because our campaigns have been very, very, I feel like effective because our community becomes a part of it, making it comedy, getting our children involved, getting our husbands involved, making it a community event like the walks, right? This coming year, our goal is to see if we can bring a mammogram van to the walk, right? If we're able to bring a mammogram van, then it's a community. It's more than just go get a mammogram. It's almost like I'm here for you. Let me hold your hand. Let's go get it, right? Yeah. Let me hold your hands so that you can go get a mammogram. So I feel like adding humanity to it, right? Not being ashamed to talk about it, and like kind of like, I don't know, maybe also creating incentives. Oh, you can win a free t-shirt. People like to always get something for something, just trying to figure out, like, brainstorm on ways, that we can keep making it better. But I feel like we've done some real effective campaigns because our children, like our kids, are involved in it, and they keep saying, "Oh, mom, my friends are like, when is the next walk? When are we gonna do this? When am I coming?" So like, and then the kids can tell their moms, "Mom, did you get your mammogram?" So now it's become a family affair. It's become a community event where accountability is not just mom hearing about it. Dad has heard about it. The kids have heard about it. Your coworkers have heard about it. So what are you waiting for? So everybody's making you accountable.
Yeah, that makes sense. I promise this was going to be my last question. So, yeah, this is our home now. So this is our immediate environment. America is Atlanta. America is our immediate environment. So I know that most of your advocacy is centered around America. But my question is this, right? Considering the fact that most of us are from Nigeria and we have a far bigger need for advocacy and medical literacy in Nigeria. What do you see in Nigeria in the context of scans? Do we have systems in Nigeria to encourage scans? Do we have good scan centers? Because I know that your organization is global, it's not just centered in Atlanta. So I want to know what's the difference between America and Nigeria that you've observed? And how can we help improve it in Nigeria?
Yeah, so Bright Health Angels is a global organization. We sponsor scans in Port Harcourt, Abuja, and Lagos, right? So scans usually, so the first to answer you, the reliability or the validity of the scan for me is questionable, but the NGOs believe that it works because they're able to identify and detect lumps, right, and further diagnose breast cancer. So they say it's working for them. So I'm not, and I say, okay, if it's working for you, then our goal is to collaborate with you, partner with you to get to the grassroots of the people that need the scan. So that's primarily what we do in Abuja, Lagos, and Port Harcourt too. So our goal as Breast Health Angels organization, a global organization, we partner with local organizations who are on ground, who understand the system, so we can get to the grassroots and the people who need the mammograms.
Okay. All right. That makes sense. All right. Thank you for the information. I'm done. Promise.
Okay.
All right. Thank
right.
you. Thank you. Comments. There's a quick comment here. Someone's just adding some more information. They said most health departments will help women without insurance with mammograms,
Yes.
especially if they're over 50 to 60 years old.
Yes.
So that's a great one. Thank
Yes.
you. All right. One other question. Mr. Obi, go ahead. Please unmute yourself, Dr. Obi.
All right, here we go.
Thank you.
Thank you. I appreciate the opportunity to be with you all, and particularly enjoyed the lecture. I joined late, but I'm hopeful that the recording will be shared with those of us who've had time to participate. I am Dr. Obi. I'm an emergency room physician and a family doctor. I'm based in Texas. And as you all can see, I'm listening with my wife who gets her yearly mammogram. Say hi, Kim. And we have 4 daughters. And so this is a topic that is highly relevant. About 5-6 years ago, a mutual friend of ours in Canada just called, said she had discovered a lump in her breast. And, these are people that we constantly encourage to emulate what we do. And she did find a breast lump. We asked her to go ahead and schedule a visit with a PCP and did a biopsy. Lo and behold, it was cancer in her I think she was in her 40s, early 40s, 41 or thereabout, or late 30s. And 6 years later, she's alive, well, and living her life, working, productive, and fairly happy. Yes, she still goes through with her mammography exams and other health maintenance visits. Now, she's fortunate to live in a country like Canada where they have, what you can call largely socialized medicine, and all the resources are in place to support whatever is health needs that she may have. My question segues off the last comment. We're all here. I've looked at the panel as well as the participants. We're all Nigerians, I believe, based on the name I see here. And the talk is largely focused on Nigeria. And that's where my interest is. And I'd like to hear either something posted at the end of the section, or in the video that will be shared with those of us who have participated, regarding the services that are available to our people back home in Nigeria, where the resources are not as well developed as they are in North America here with us. Mammography, as we know, and other screening modalities may just be the very first step. The real dance starts after a diagnosis is made. If a diagnosis is made in a country like Nigeria, what are the support systems in place that we can latch on to, especially for the less privileged and people without the means to undergo HERS-1 and HERS-2 screening and the consequent therapy that will follow such a positive diagnosis and that unfortunate incidents. I would like to know if your organizations have some other NGOs and even governmental organizations, especially in Eastern Nigeria, that we can reach out to, partner with, to support the very expensive post-diagnosis care that cancer therapy usually requires, both the immediate care and ongoing care. And with that, I'll take your comments, and I do again thank you for such a wonderful and very, very useful and needful information and section.
All right, and before Doctor goes with that question, just a little correction. We have, this is a diverse audience. We have Americans, we have Caribbeans audiences. So just a correction. All right, not just Nigerians.
All right.
All right. Thank you.
Thank you.
Yeah.
So in terms of resources, I do know that there are a few NGOs. You know, Nigeria's problem is monumental. You know, when it comes to resources, you're talking about, it's multifaceted. You're talking about education, getting the word out there. You're talking about healthcare literacy. You're talking about the mammographic availability. You're talking about power supply. You're talking about the validity of the test you run. And you're talking about just one mammogram is not enough. In the United States, these women, they're entered into an automated system that reminds them every year to have a repeat mammogram. So you can have a mammogram at age 40 and possibly never have another one in Nigeria. So there's just so much going on. I mean, a number of good natured citizens have gone back to do some things with the community, but except it's coming from the government, because you need something in large scale, you know, to be able to go to the tertiary centers or build community healthcare system. You know, you need radiologists to read the mammogram. So you need that specialized care. There's brain drain in Nigeria. You don't have the power. You have the equipment. You don't have the servicing or the maintenance culture as it is in Nigeria. I think there are only 2 or 3 centers where people get radiotherapy. So you're diagnosed with breast cancer. You don't even have where to go to get radiation treatment. You know, it just goes on and on and on. And except it's adopted on a larger scale by the government and healthcare sector, I mean, individuals can only make a splash in the pond. You know, we need bigger manpower, bigger resources to take care of the problems in Nigeria.
All right. Thank you, Dr. Obi. And Dr. Chika, of course, she made us to understand that she's attending another event, so she may not be here for too long. But of course, we still have Dr. Obi Obata here. A question on the Zoom platform: if a lady with breast cancer removes her breast due to the stage of the cancer, and of course the doctor's advice, would there still be traces of the cancer in her body after removing the breasts?
So it depends, yes and no. So usually when women are told to remove their breasts, it's because there's no obvious trace of cancer that we can see. By the time breast cancer cells are in microns, they're very small. So you can't see them on scans. And that's why we have this newer technology that measures circulating tumor DNA. But when you take out the breast cancer, when you take out like stage 2, so the bigger the cancer and the more lymph nodes are involved, that's the higher the stage, goes from stage 2 to stage 3. And the higher the stage, even when you take out the breast, the more likelihood that it will come back. Because if the cancer was big enough for some of the cells to break off and go to the lymph node, it's possible those cells have traveled to the blood and other parts of the body. But since they are small microns, you can't see them with the naked eye. You can't see them on radiography. So it's after a while. So that's why you see women, they have surgery, they have radiation. A few years later, it comes back. Well, those cells were in the body when the breasts were taken out. It's just that we couldn't see them because they were too small. They were, at that point, what we call micrometastasis. So you can't see it. Then over time, it just grows and becomes big tumors, and it's evident on scans. So yes, you can take out the breast tissue and still have some cells, but that's why we talk about early detection. The smaller the breast mass is, especially if there's no node involved, the less likely you have cells left behind when you do the surgery. So do the mammogram and detect the breast cancer early, and also you're able to do something about it.
Thank you. And just a follow-up to that question, what stage of cancer or breast cancer requires chemotherapy and radiation? And then, for example, a stage 2, do you think that requires chemotherapy? And if they take chemotherapy, does it also require a radiation as a follow-up?
Yeah.
For as low as stage 2. Yeah.
So that brings us to the breast cancer subtypes. So the chemotherapy depends on the kind of breast cancer you have. So you can have a stage 1 breast cancer and require chemotherapy if it's triple negative. So when you're hormone receptor positive, that means you can treat with hormones. If you're HER2 positive, that means you can treat with chemotherapy, with targeted therapy, because targeted therapy always is used with chemotherapy. But when you don't have any of those, the only option you have is chemo. So even if you're stage 1, but you're triple negative, you need chemo regardless. So it's not really a stage thing. Stage matters. It's more like the biologic type of breast cancer. Then talking about radiation, so what we compared in clinical trials is breast conservative surgery and mastectomy. Mastectomy is taking the whole breast out. Breast conservative surgery is doing a lumpectomy with radiation. So there are trials that compared the two and found that there wasn't much difference in survival between the two. Women are often attached to their breast. No woman wants to lose her breast. So if it's a small tumor, depending on how mutilated the breast will look if you have surgery, if it's a small tumor in a big breast, you can get away with taking the lump out and doing radiation, and you'll get survival rates equivalent like you took the whole breast out. The only thing is that there's increased risk of breast cancer in that breast for sure, and you still have to continue the mammogram and sometimes breast MRIs.
Right, thank you. I know we are rounding up now. One question. They said, are you familiar with a scenario where someone goes for a scan and they found very small tumor, but yet that person was told it's not cancerous? Do you have any advice for that person? Because much later, can that become cancerous? Yes. Any familiarity to that?
So if it's small and it's been evaluated with a mammogram, so not all breast lesions are cancerous. But if any abnormality in the breast that is not normal breast tissue predisposes you to cancer. So it's definitely something I'll want to continue longitudinal follow-up on. If you remember my slides on 2.1 to 4 times and greater than 4 times, ductal hyperplasia was something that predisposes. Once you have an abnormal tissue there, except the body heals that tissue completely, there's a chance that abnormal tissue can progress on to a plastic disease, which is cancer. So yes, if it's been told that it's not cancer, it's definitely something. Once there's something in the breast that is not quite right, I would recommend that, you have close follow-up and biopsies if necessary until you're sure and make sure it's not cancer going forward, because the risk of having cancer in that breast is higher. But not all breast lesions are precancerous. So those are two things.
All right, thank you, doctor. And a lot of, appreciate a lot of people saying thank you for the great speech and lecture. One last question. I see another hand.
Yeah.
Mr. Chike. Yeah, go
Yeah.
ahead.
Last question, please. I know that this is Women's Day, and this is breast awareness for ladies, but what about men? What percentage of men are predisposed to, from your experience, what percentage of men are predisposed to breast cancer? The first question is, I don't know any man that has breast cancer. Is this something that occurs in the male species? And how many men are predisposed to that?
So very few men have breast cancer. In fact, for every 300,000 women who have breast cancer, only 3,000 men have. So it's 100 women to 1 male breast cancer. So for men, it's not even in the top 20 cancer diagnoses. Once a man has breast cancer, we always send them for genetic testing to see if they have a germline mutation. It's very, very rare. Very, very rare. So yes. Like I said, they said about 280,000 new cases of breast cancer. It was about 2,700 new cases of male or female breast cancer invasive. There are about 2,700 new cases of male breast cancer that was projected by the American Cancer Society for 2024.
Thank you very much for that information.
You're welcome.
Dr. Obi, Dr. Chika, it's a big, we can't thank you enough for this, for your time. Just for a closing remark, let me bring the president of National Association of Sea Dogs, Atlantis DEC, the Atlanta chapter, Mr. Jude Oroigu. He's gonna just give the closing remark. Over to you, Mr. Jude.
Thank you. Can you hear me?
Yes, loud and clear.
Okay. Good morning, good afternoon, and good evening, everyone, depending on your location around the globe. It's an honor for me to have the floor to express my heartfelt gratitude. First and foremost, I would like to thank Dr. Obi Ogbata and Dr. Chika Okemakwuwu for taking their time from their very busy schedule to grace this event with their presence and sharing insights on the subject matter. We are very, very grateful for your wisdom and time. Special thanks also goes out to the organizers and facilitators of this event, in the persons of Dr. Marcel Akuneme, Mr. Agboyega Shinawo, Mr. Daniel Kure, Mr. Oni Olamide, Mr. Ese Folami, Mr. Sam Toje, and last but not the least, Mr. Chike Madeguna. And to our esteemed guests, participants, and audience, thank you for your presence and engagement. Your support and involvement added immense value to this event. Once again, I want to say thank you all for being part of this event, and we hope to see you again in the future. Have a wonderful rest of your day, and may God be with all of you. Over to you, Mr. Moderator.
Thank you, Mr. Jude, our president. And just to echo some key words, stay proactive, early detection will save lives, and do not be scared to go for mammogram. All right, thank you, everyone. We really appreciate you for coming in. Thank you again to our president, the organizers, to the speakers. It's a pleasure having you. At this point, we will be drawing the curtain. Have a great rest of the day. Thank you.
Thank you, moderator.
Thank you.
Thank you, president. And thank you to the speakers. Bye.
Thank you all. Thank you.